Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, July 8th, 2024. Today's podcast is a short one, but I'm very excited about it. Stephanie Melka joins me to talk about nitrous oxide, or laughing gas, for gynecologic office procedures and exams. Last November, Melka and I did a podcast called I'm Going to the Gynecologist. Will it hurt? And what can I do about it? Definitely check that podcast out if you have not heard it yet. Since that podcast dropped, we were able to add nitrous oxide as an option for patients in our own office, mostly for office procedures, but also for people who just have a really hard time undergoing a GYN exam, which happens. So today, Melka and I are going to talk about nitrous oxide, how it works, what we use it for, and what the experience has been thus far. All right, a few reminders. I wrote a book with Emily Oster called The Unexpected. You may want to check that out. You can buy it anywhere you buy books. Second, if you have any questions for our mailbag podcast, please do continue to email them in, either to hw@healthfulwoman.com or go to the website and click on the link that says send us your questions. Remember, these questions are for the mailbag podcast. Please don't try to ask medical advice that you need answered quickly, because sadly I won't be able to answer it quickly and then I feel bad. If you do have a question like that, please ask your own doctor. All right, thanks for listening. We'll see y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Melka, welcome back to the podcast. How goes it? How's life?
It's great. So excited to be back.
We're excited to have you. We're just super duper excited to have you. This is like a follow-up to our prior podcast that we did on Will This Hurt?
Yes.
Right? I'm going to the gynecologist, will this hurt? And at the time, and people, you can go back and listen to the podcast, we went over all these various options for, pain control, pain relief, for the gynecologist, for, complicated procedures, less complicated procedures, just an exam. And we're going through all of that. And then right after we recorded that podcast, we had a big development in our office. What was that?
We now offer nitrous oxide, also known as laughing gas, in both of our patient offices, both Carnegie Women's and Maternal Fetal Medicine Associates.
Yeah, so at the time we were sort of trying to figure out if we could do it. Yeah. There's some logistics involved in getting it and having the right equipment and this or that. And so we rolled it out a couple of months ago, and it's been really helpful for a lot of our patients. And I predict probably more and more over time. And we decided it'd be a good idea to sort of append the prior podcast and talk about this, I think in its own right, because this is a little bit, I don't want to say out of the box, because it's used all the time for other procedures, but it's not something that we sort of had available to us when we were training. A lot of OBGYN offices don't have this ability. And so this is something that potentially is a little bit new to people in terms of pain relief options for going to the gynecologist specifically. Obviously, with the dentist, this is very common, but going to the gynecologist, not so much. So let's talk about that.
Yes.
So what was the impetus to have this?
That sometimes what we do causes pain, discomfort, emotional distress, all sorts of different things. And this is a way to help ease some of that.
Right. And we do have some experience with this, or have had in the world of OBGYN, but mostly in labor.
Yes.
And again, a lot in Europe, not as much in the US, although many labor floors have it and are sort of advancing that a little bit further. But we know about it in pregnancy, mostly from labor.
Yes.
And then obviously for gynecology, it's not related to pregnancy, but we have just experience in it. So we have a working knowledge of it, is what I would say. And what is basically happening when someone takes nitrous?
So nitrous is a gas that somebody breathes in. It works sort of at the level of the brain to basically decrease anxiety and causes a dissociative effect where people will still feel pain, but they sort of just don't care. You know, like they're sort of like, some people say they feel like they're flying, they're loopy, they're out of it, they're giggly, like they feel a speculum being placed, but instead of thinking, ow, that hurts, they're just like, oh, I feel that. And it doesn't have that same discomfort associated with it.
Right. And that's why it's sometimes called laughing gas. Right. Again, I think that if people have had the experience of going to the dentist and having this, it's sort of the same conceptually, that there's things that dentist does that could actually like objectively cause people pain. And it sort of helps with that. But also a lot of people, because of those experiences or the anticipation of that, have anxiety over what's going to happen at the dentist. And so even if, let's say, two people come and they're going to have the same amount of pain, and even if they experience pain the same way, one person might be much more anxious about it than the other person, which can clearly make the experience worse. And laughing gas is very, very helpful for that regard. Now, could you use it to operate on someone, to do like a C-section?
No.
Right. So it's not full board anesthesia, and it's not meant to be. And that's not the point of this. It's just meant to maybe take a procedure that was going to be more painful and make it less painful or not painful. Yes. Ideally, that would be the goal. Now, when someone is getting nitrous, what is happening? Is it strapped onto their face? Is it sort of like,
so
put on a mask?
That's the beauty of it. It's entirely patient controlled. So they have a nose clip that they sort of pinch the bridge of their nose or the nostrils to make sure that every air they're getting is through their mouth. And it's a little mouthpiece. It's like a giant straw that they put in their mouth, and they just breathe in and out through it. It takes about 2 or 3 minutes to take effect. And for as long as they're holding that mouthpiece and breathing through it, they're getting the effect of the nitrous. And then as soon as we're done, or if the feeling is getting too overwhelming, they just take it out and breathe room air. And it wears off within a few breaths. Right.
It's a great form of what they say in the anesthesia world is patient-controlled anesthesia, where the control over how much you're getting is in the hands of the patient and not in the hands of the doctor. And the advantage to that is people can take more or less of it as they are experiencing pain or not. And the other thing about this, which is particularly helpful, and this is true, in the office setting, it's true in labor, is since it's something that the patient herself has to hold into her mouth or by her face, if she gets so like loopy to the point that she's, nearly passing out, it's just going to fall from her face, and it'll sort of, that's like a safety mechanism that you can't quote unquote overdose on it, right? So we don't like strap it to someone's face and put it on for the whole procedure. We let them decide how they're going to do it. And if they they fall asleep, it's just going to fall off their face. And then again, if they sort of potentially wake up, they could put it back on. So that's a really nice advantage. And also in sort of the psychology of experiencing pain and anxiety, having that control over your own pain medicine is potentially very, very helpful for a lot of people, on top of the physical pain, but just sort of that experience of it. Okay. And then when you said that it wears off very quickly, how quickly are we talking about?
2 or 3 minutes.
Right. So this is also nice because you don't have that hangover, that groggy feeling afterwards, for when we were talking about maybe taking narcotics or Valium or something, which work, but they're going to last for 2, 4, 6, 8, whatever hours based on what dose you took. Again, general anesthesia, if you go to a hospital and you get put to sleep, it's also going to have like a lingering effect on you for X amount of time. But this really, do you tell people that they need someone to drive them home?
No.
Yeah.
No escort. They rest in the room for a few minutes and stand up. They're good to go.
It's really pretty impressive stuff. And so let's say someone is considering this, right? Just take us through what happens logistically, step by step, from the point of your conversation to the procedure to afterward, just so someone knows what to expect.
Yeah. So when I'm counseling a patient on an office procedure, which is typically IUD, colposcopy, certain biopsies, I will offer this as a form of pain relief. If the patient wants it, it does end up being an additional out-of-pocket charge, since it's not covered with insurance.
Right.
But then they sign a consent form, go to an exam room, and basically we get everything ready for the procedure. And then right when we're ready to start, they take the mouthpiece, they start breathing, and then we look at our watch and time 3 minutes, because it takes about 3 minutes for it to take full effect.
Right.
And what I found is often at 90 seconds to 2 minutes, like the patient sort of looks at me and like the eyes are a little glassy and I just get the thumbs up and it's like, all right, there we go.
We're good. And then these are portable canisters.
Yes. Oh, yes.
And so we can wheel it from room to room. It's not attached to the wall or anything like that.
It's on a little cart with wheels. It's an oxygen tank and a nitrogen tank. It's light. One person can use one hand to wheel it around.
Yeah.
There's a big tubing system that goes along with it. All of that stored in a closet somewhere.
Right. And then the tubing it's disposable. So we change those patient to patient. The tanks are obviously the tanks and we refill them as they empty. And, when you mention the cost, we should talk about that. So unfortunately, this is not covered by insurance, right? If we write a prescription for Valium and Percocet, typically it's going to be covered by insurance and you go to the pharmacy with whatever your copay is. If you have a procedure in the hospital or if you have an anesthesiologist administer you intravenous anesthesia, usually that's covered by insurance, again, with copayments, whatever it is. But this is not yet covered by commercial insurance, again, unfortunately. So we sort of have to figure out what to do about that, right? So on the one hand, we want to offer it to people. On the other hand, there is a cost. So we basically tried to pick a price point that was reasonable, that it's, essentially cover our costs. It's not meant to be a big moneymaker. I think it's like $100 or something like that. Yeah. And so it's not nothing, but it's meant to be something that's not prohibitive and allows us to be able to offer it to people. And obviously, if it got to the point that we're doing a bajillion of these, the price could come down, but we're not at that point yet. We'll see. So there is an out-of-pocket cost. And I think that's probably pretty typical for OBGYN offices who offer it. Maybe when you go to the dentist, it's part of the coverage.
It depends.
Yeah. I don't really know. Yeah.
I know a few oral surgeons that use this and ask them, and they said, like, if you're just getting nitrous, then you pay for it. But if you're getting like nitrous with other anesthetics, it's sort of I think they just lump it together because it's sort of easier.
Yeah, this is part of the oddities of commercial health insurance and what is and is not covered. And it's definitely beyond the scope of this podcast and the two of us trying to understand it. But that's the unfortunate reality. Okay, so someone has this and they're done and basically it's gone. It wears off.
Correct.
All right. So who would this be ideal for?
Pretty much anybody that wants it. We initially, the initial thought is procedures, which can be uncomfortable. But there's plenty of women out there that have had a difficult pelvic exam before where they have anxiety. Some women with vaginismus where they have physical pain.
Yeah.
And these things often limit their ability to get an exam.
Yeah.
Some women physically can't deal with the discomfort of an exam. Some women emotionally just don't go to the gynecologist to avoid having a pelvic exam. And this definitely can help with that.
Yeah. And I think that's a really important point. I mean, it makes a lot of sense that okay, someone's having an office DNC, maybe this will help, or someone's having an IUD placed or a colposcopy with biopsies or whatever it is. It's something where we expect there to be some amount of pain and different people tolerate pain differently. And this is really a good option for you. And again, for some people, maybe it's not enough. Maybe for certain people for procedures, they do need like a narcotic, something that's a little bit, a denser pain block, more long acting, deeper, or they might need to be in an operating room and get literally put to sleep by an anesthesiologist. Fine. If that's what someone needs. But for a lot of people, it'll allow them to have office procedures. But I think that next category that you were talking about is really the critical part here because it's totally reasonable for people to have a lot of difficulty going to a gynecologist and getting an exam. Right? Most people are fine. They, they do it. They may or may not, they don't love going, but they do okay and fine. But there's a lot of people who that's not the case. And it's really painful for them. And it's really anxiety provoking for them. And like you said, it could also lead them to not get the care that they need because they're avoiding going to the doctor, avoiding exams that they might need, which is unfortunate, but it's understandable. And we really didn't have great options for them, right? We do our best, obviously, to be, to talk people through it, be very gentle, but, to do all the things we can try to do. It's very hard to book a case in the operating room and say, what are you doing? Like pap smear.
Right.
And it's just very hard. Yeah, logistically.
That cost is often very prohibitive for patients.
Yeah. So because, even if technically you can figure out a way to get something covered, there's big co-pays for your hospital, getting things like that. And so that's very, very difficult. And not everyone wants to take a Valium and a Percocet to go to the gynecologist. Like they're out for half a day. And so this is really an opportunity for people who are out there and I dread going to the gynecologist. it's real uncomfortable. It's really painful. It's really anxiety provoking. This might be a way that you can do it and really not feel that.
Yeah.
And then number one, the day of, it won't be as unpleasant. And number two, probably for the next visit, you won't have the same level of anxiety coming into it because you know that there's an option that it won't be. And either you'll use that option every time, or maybe just having an experience that wasn't so painful might lead you to feel differently the next time. And I think that that's the future for this. It's not so much to be able to switch operating room procedures to office procedures. That's not really the goal. It's more to just make the experience for people less unpleasant, because God, we don't want it to be unpleasant, you know? Yeah, it's a really cool thing. So you've had experience with this.
Yes.
What's it been? So I've heard I'm not doing procedures that require this currently. I'm sure I could or would, but what's been the experience for you and for our office thus far?
Everybody has had positive things to say about it. With a recent procedure, that patient just sort of stayed calm and relaxed, and afterwards was like, that was wonderful. You know, she's like, I've made the mistake of going down the TikTok rabbit hole of how miserable IUDs are. And this was the opposite of that.
Yeah.
Some patients have even appreciated just that we offer it, even though they opted not to do it, where they're like, wow, that's so nice of you. Like, but nobody else does this.
Yeah, we're really happy about this. We're really proud that we're offering this. Again, it took a lot of legwork from the doctor's perspective to get the right protocol, to make sure we're doing it in a safe way and everything. Obviously from Farida, our clinical manager, who was sort of overseeing it and teaching all of our medical assistants. You know, there's an in-service for how to use it, what to do, what to expect. And so there's a lot of time.
Yeah.
I know you put a lot of time into this, you know, developing sort of our guidelines for it and how we're going to roll it out. And we spend a lot of time as a practice talking about it. And now that we're doing it, obviously reviewing how it's been going. But it's something that's really, it is a, you know, a point of pride for our practice that we can offer this to our patients. Hopefully this is something that more and more doctors will be able to offer to their patients. If not, come to us. Happy to have you, you know, whatever, you know, come for some, you know, and then you were saying, you know, there's other uses for nitrous that are more recreational potentially.
Many years ago in the hospital on the labor floor, a patient was using nitrous, and the husband pulled me aside very serious. If I go to a Fish concert, they're selling balloons outside of laughing gas. Is this what they're selling? I was like, yes. And he's like, oh, honey, you're going to be fine. This stuff's great.
It is great. But bring the tank and let's head over to the Fish concert. It is short acting. So, you know, don't expect it to last by the time you get there. We have not had any use by the staff as of yet. So we are not doing that. It's for patient use only.
Yes.
But it's, again, fortunately, it's a very safe and effective method. And so for all of our listeners out there, if you are not by us and you have an opportunity to try this out with your doctor's office, do so. If not, you could ask them, hey, I heard about this on a podcast. Is this something you could consider getting in your office? And maybe they haven't thought about it or realized it was an option. And absolutely, or not absolutely, but probably it is. They just have to figure out, again, the logistics of it, where to get it from, how to do the tubing, how to do it. You know, are we going to charge for it? Are we not exactly how to do that? And if you're someone, a patient of ours or potentially patient of ours, and this is something you're interested in, how would they ask about it?
So typically best done in the counseling before the procedure. You know, it's the way our office is set up. People aren't usually coming in for like same day, first appointment and procedure.
Right.
Usually they have the first appointment first. Let's say it's birth control. We plan an IUD and then it's a separate appointment.
Right.
But even if it is something where it's all same day, we're always talking to our patients first. Like we're not meeting them in the exam room undressed. We're not meeting them when everything's already been decided.
Yeah.
So there is that FaceTime with the physicians beforehand.
Right. Or even if it's just for, again, a first time gynecology visit and you're someone who knows that exam is going to be really, really anxiety provoking or possibly painful for you. You don't have to arrange this in advance. I mean, you could call and say, hey, listen, I'm pretty sure I'm going to want to use this. Or you can just wait, talk to the doctor and say, hey, you know, exam's been really, really hard on me in the past. And then I'll say, hey, do you want to use nitrous? And we could set it up same day. Again, since it's portable, we could bring it to an exam room. It's really, fortunately, pretty straightforward. And it's not something you don't need like a procedure room for it. Because again, after a few minutes, everyone's fine. They get up and walk out. And
our schedulers know if a patient says, I want nitrous, to just put it on the schedule.
Yeah.
So if you were scheduling a new visit, you could say, I need a new GYN appointment with nitrous. And they'd put it on the schedule.
Yeah.
You'd still have the time to talk about it, but that also helps logistically.
Right. Just to make sure that it's available, which
Yeah.
it should be because we do have it available. Awesome.
Cool.
Nitrous. Good stuff, Melka.
I know, I'm so excited about it.
Awesome. All right. For all you out there, if you need it, if you want it, let us know. And we're really happy to be able to offer it to you. And hopefully this will be a regular thing across the country for doctors' offices. Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.